You've recovered from your endometriosis surgery. Everything went according to plan with a reputable surgeon, yet you're not feeling as well as you thought you would have. You may still have bladder symptoms, painful sex, body-wide unprovoked pain. This is more common than you think. You are definitely not alone. And in today's video, we are going to talk about what could possibly be happening and what you can do about it. Historically, endometriosis was thought of as a gynecologic disease, but today we know that women with endometriosis also have impairments in the musculoskeletal system, including the pelvic floor, the gastrointestinal system, the urologic system, and the central nervous system. While this may sound daunting, it actually provides a more comprehensive paradigm for treatment for women suffering, and this far extends beyond the surgery itself. So recent studies have shown that people with endometriosis also have significant amounts of myofascial trigger points and high-tone painful muscles in the muscles of the pelvic girdle, which are your abdominal wall, the muscles of your back, the muscles of your external hip, as well as the pelvic floor. Now, endometriosis surgery will treat some of the underlying causes of pain, but removing the causes of pain with surgery do not necessarily normalize the muscles that I just mentioned. Therefore, an evaluation with a pelvic floor physical therapist is warranted for anyone who has gone through endometriosis surgery. During a pelvic floor physical therapy examination and evaluation, the physical therapist will identify any of the areas of muscle dysfunction that may exist. That can include the abdominal wall, the back, the hip, and the pelvic floor muscles. When these muscles are impaired, they can cause unprovoked pain in any of the areas that I've mentioned. They can cause urinary urgency, frequency, and pain. They can cause superficial and deep painful sex. A physical therapy evaluation will identify if in fact there is muscle dysfunction present, when historically all of those symptoms may be tied to the endometriosis itself. A hallmark symptom of endometriosis is dysmenorrhea, which means painful periods. As this occurs month after month in people suffering from endometriosis, it is basically a noxious attack on our muscles and tissues. What that means is that people every month experience what's called the viscerosomatic reflex, in that something in the viscera, which are the endometrial implants, are causing negative stimuli to the muscles of our pelvic floor and our pelvic girdle. As this occurs over time, those muscles experience tightening and therefore pain that does not necessarily resolve when the period ends. Therefore, it's not unexpected that these muscle dysfunctions completely resolve when you have surgery either. These are a separate issue that developed because of the endometriosis that needs to be properly treated. For this reason, anybody who has dysmenorrhea or has gone through endometriosis surgery should have an evaluation with a pelvic floor physical therapist to see if these muscles are in fact impaired and possibly contributing to things such as body-wide pain, superficial or deep painful sex, and irritated bladder symptoms. People suffering from endometriosis often have urinary urgency, frequency, and pain. The reasons for that are multiple-fold. One reason is because of what's called visceral sensitization, meaning that the endometriosis itself is also sensitizing the bladder and making it painful with bladder filling, sometimes difficulty to empty the bladder, and sometimes just feeling a sense of urgency. Now, as we also mentioned, people with endometriosis often have pelvic floor and girdle muscle dysfunction, which can also make irritated bladder symptoms occur. So therefore, it's important to recognize that there are multiple reasons why people have the bladder symptoms that they do with endometriosis before or after surgery. And looking at the musculoskeletal system, as well as potentially the urologic system, and factoring in where the endometriosis plays a role, will help people get rid of the bothersome symptoms. The gastrointestinal tract also can be a victim of viscerosensitization, as we just described with the bladder. Every month as someone goes through a pain episode as they get their period, they suffer from dysmenorrhea. That can also sensitize the lower GI tract, and as a result, many people with endometriosis have bloating, constipation, feeling gassy or like they need to burp on a regular basis. As this occurs over time, there's also a correlation between gastrointestinal disease such as either type of SIBO and H. pylori that commonly exist in women that have endometriosis. Successful treatment is going to involve eradicating the painful stimuli, which is the endometriosis, but then also the GI tract itself may need appropriate treatment if any of the pathogens that I just mentioned are actually present. On top of all of that, endometriosis and the pain that can be associated with it will change how people perceive pain in other parts of their body. People may go through scenarios such as a thing called allodynia, which means that people feel pain in response to normal touch, and hyperalgesia, which means that painful stimuli is 10 times more painful, for example, in people that have been through endometriosis. When we treat the disease itself, the central nervous system changes can still persist, and they can also be exacerbated by the GI, the urinary, and the pelvic floor and girdle muscle dysfunction. So the most appropriate treatment for people would be to successfully investigate all of these various areas to see if it's contributing to somebody's persisting symptoms. So if you are having persisting symptoms in any of these categories, the first place to start would be with a pelvic floor physical therapist who can help you identify if other areas of medical management is necessary. As we mentioned earlier, almost all women who have been through endometriosis surgery do have pelvic floor and girdle dysfunction. And the pelvic floor and girdle dysfunction can contribute to the urinary and bowel and central nervous system issues. Typically, in a one-on-one appointment with a pelvic floor physical therapist, they will help you identify what types of muscular dysfunction need to be treated in physical therapy and also help you figure out if other workup is needed to deal with the central nervous system changes, the urinary tract, or the bowel tract. Here at the Pelvic Health and Rehabilitation Center, we're happy to see you in person to identify what impairments you may have that are contributing to your current symptoms. If you're unable to come see us in person, we can also help you troubleshoot your symptoms and get you to someone who can help via our digital health program.